Hey, welcome, welcome, welcome. My name is Tamara Green, pelvic rehab therapist, and I help women overcome uncontrolled bladders, return to pleasurable sex, and manage pregnancy symptoms to become postpartum champions. Welcome to Below the Skirt with Tamara. This is the last live when it comes to prostatectomy for the 4-week series that I did. Now, as you can see, the conversation or the title of this live is Getting Your Groove Back. Now, depending on what floats your boat, right? If for women, like I said, depending on what floats your boat, men having their stuff together allows us to live our best life below the skirt too, right? So I'm going to talk about 3 points when it comes to getting your groove back after having your prostatectomy performed for men. The first thing is, what is a conversation that needs to be had? Secondly, will my soldiers continue to march? And third, how long will it take for me to return back to my Mack truck, right? So those are the 3 things we're going to talk about. So let's dive into the first question as to what is that conversation that needs to be had. Now you're going to have men, if you've had your prostate removed, or you are in the process or a candidate for having your prostate removed, what's the conversation that needs to be had? First of all, the conversation needs to be with yourself, knowing like, hey, first of all, I have to take care of the situation that is at hand. Getting the cancer out of my body. That's the first step. And secondly, the conversation needs to be to yourself for you to have with your significant other, for you to have with your wife, whomsoever. It's like, okay, how will things change within myself? How will things change within myself? Yes, we've already talked about the urinary incontinence. That's going to happen. There's no if, and, or buts about it. That is a part of this process. But the biggest thing when it comes to this live where I'm discussing with you is sexual dysfunction, erectile dysfunction. So that is going to be a part of the process. So you have to know, okay, I'm going to have to pack my whole luggage bag with me as I go through this process. I am still all the man that I am, but I'm having some problems. Having that conversation with your significant other or your wife or whomsoever, I am not going to be able to perform in the bedroom like I did before. But that's okay, because guess what? As I tell my men, there's so many other ways that you can still get the job done without fully being at work. How can we still get the job done but still be fully at work? So I'm going to talk about that a little bit into this. And secondly, will my soldiers still march? So when I'm talking about soldiers, I'm talking about your sperm. So let me give you a little bit of anatomy, a little bit of understanding. Again, as I spoke with in a previous live, when you've had the prostate removed, the prostate helps makes semen. Now, semen is not sperm. Sperm is made in the testicles. So what happens is the sperm is still being created. You're still having soldiers. The thing is, are they marching? So I'm going to give you an example. So I would picture turtles, right? What happens? The turtles hatch from the eggs, right? They walk to the water, and what happens? The water pushes them out to the sea or wherever they're going into the ocean. It's the same thing. What's happening is you are still hatching turtles. So you are still having sperm that are created, but because there's no semen, it's not taking it out to sea. So what happens is the sperm gets absorbed into the body. So there's not a problem with that, and that's okay. But just to let you know, you still have soldiers. The thing is, they're just not marching. So that's why you may hear people say, hey, I'm shooting blank shots, because there's nothing being produced in that manner. So hopefully that answers that question if you wanted to know that. So no more babies being created. Third, how long will it take for me to get my groove back? How long will it take for me to become that Mack truck, not the semi truck, the Mack truck? So I'm going to tie the beginning question is that conversation that needs to be had, and the third component of how long will it take me to return to my Mack truck. So first of all, Again, when you're about to go through that process, you need to have a pelvic physical therapist like myself or someone in your area on your team, because there's some beginning measures that needs to take place versus what some ending measures needs to occur. Now, when you will have a form of erectile dysfunction, right? So you're not sleeping, all of a sudden you just jump up, just like an erection. It takes time. Now, as you know, with any procedure, nothing is 100% guaranteed, right? And we're just going to put that out there. You never know what your final outcome is until time. So time is the measure of what's going to typically how it's going to be at the end. It takes time to know what your end result is. So the result is, so the biggest thing is, it depends on where you were pre-operatively, right? What was going on then? Were you having some other issues? Were you having, did you have diabetes? And if you didn't know that, diabetes can, if it's not controlled, can cause erectile dysfunction. So what was your beginning situation? Because that will be a component of it. Also, too, how involved was the surgery? How much work was needed? So what went on during the operative component? Now, those are some beginning things. Now, it also depends, too, when it comes to how can I get my groove back. Until you're able to get your groove back, you may have to take other modifications for yourself when it comes to that. Because if you're having erectile dysfunction, you may need some assistance. For example, your doctor may recommend Viagra or may recommend Cialis. Those are different type of medications that can help with erection. You may be in the process, and these are things that we also speak with. So your doctor would recommend that type of stuff. But in itself, we also give you guidance as what some other measures, because everybody's goal is different. What Jim's goal is may not be the same goal as Harry's goal, right? You may not be sexually active, so it may not be a concern. So it just all depends where you're trying to do and what you're trying to do and how soon you're trying to get there. But something else as well, recommended, there's something called vacuum devices, right? You can utilize a vacuum device to help stimulate, as well surgical techniques that are out there. You can use a semi-rigid implant, or you can use an inflatable implant. So there's different type of external factors or internal factors that can help to get the goal that you would like when it comes to having an erection, right? So now the component is, so that's when it comes to the whole erectile dysfunction. Now, components too, when it comes to the preoperative component, again, patient education is the key to everything. Patient education. So when I say patient education, I'm talking about you. The more you know, the more you can be proactive about yourself, the more you can be able to be engaged with your process so you can have the best outcome. Now, is it 100% guaranteed that you will become the Mack Truck? I will answer that no, it's not 100%. Nothing is 100%. But depending upon what your situation was before, what your situation was during the procedure, that'll definitely give you, your doctor, and give your pelvic therapist an idea of where you will go, how long it could possibly take. So every situation is totally different. But in reference to the patient education, we speak with you about at the beginning what to prepare for. Okay, if you're having this much leakage, what type of protection do you need? Do you need just pads? Do you need Depends? Like, do you need some type of continence clamp? So there's so many different avenues that we can take when it comes to incontinence. Secondly, behavioral. When I say behavioral, I'm not saying that you're crazy. I'm saying there's a lot of behavioral things that men, including yourself, that you may do that will decrease your outcomes or make your outcomes possibly less favorable, or you're not getting to the goals as quick. Sometimes it's what we do in our everyday routine, or things we may change because we think we need to do certain things. Like, for example, I had one of my males, he said, okay, well, I know I just had my prostate removed. I need to drink as much water as I can to be able to pee more often. He didn't need to do that. So he was drinking certain things like teas. Those are stimulants that's going to make you urinate. So those are things like when I say when it comes to behavioral, we teach you some behavioral changes you may need to do so can be able to have the outcomes that you so desire. Now, pelvic floor strengthening. Again, as I explained before, if you're having incontinence, the likelihood of you having an erection is very slim. Because if you're not able to engage the pelvic floor muscles how you need to stop the leakage or the leaky faucets or incontinence or unwanted leakage, giving you all the examples how I say it, it's going to be hard to engage the muscles as well when it comes to having an erection. So that is very, very important for you to understand. So there is a process. You have to get the incontinence control to be continent. And after that, you'll start noticing improvement when it comes to the decrease in your erectile dysfunction. Now, other ways we may do it is not just because of Kegels, like there's so many other ways that we can work on it, but you may need some stimulus of engaging those pelvic floor muscles. You may need some form of electrical stimulation, a form of biofeedback, so you can engage those muscles to be able to do what we're trying to get them to do, to stop leakage, which is stopping incontinence, stopping unwanted urine, and also stimulating muscles. So then we can also work on strengthening when it comes to your sexual life. Because what happens is when you're having an erection, the blood flow is going into the muscles, right? And those muscles are helping elongate the penis, which is going to take you into an erection. But you got to be able to get those muscles need to activate, right? If they're too sleepy, they're not going to activate. If you've had some type of nerve disruption, again, there's a lot of things that goes on when you have your prostate removed. And the nerves are affected some form of measures. And it takes time for those nerves to regenerate. And when I say regenerate, they need to kind of regrow so it can be able to do what they need to do. So no matter how much you may try to make something go faster for the outcome that you're looking for, it may take longer than that. It just takes time. But in the meantime, there's so many things that pelvic physical therapy can do to help decrease your embarrassing moments, to decrease the isolation of you not wanting to leave your house because you can't hold your bladder long enough, or you're afraid that you're going to leak and it's going to show all over your pants. It helps with saying, hey, what are my options when it comes to my sexual life? Now, when it comes to an implant, no, that's not what physical therapy does, but we also talk with you about options there are, and then we can help usher you to where you need to go so you can have the outcome that you so desire. These are the things that pelvic physical therapy, that as pelvic therapists, as what we do. We are a resource. We're a resource from the beginning when it comes to what is actually having the prostate removed, what is involved, what are the deficits that I may not see. Hey, I know that they have taken out a source that is contributing to some form of cancer at that location, but what are the deficits that are going to come behind that? And that is what men are not prepared for enough. I'm not saying your doctor isn't, and I'm not saying doctors aren't saying that. I'm not saying that. But I don't think you as a man know the level, how it's affected, how it will affect you. It'll affect you from a mind standpoint. When I say confidence, it'll affect you physically, strength-wise. It takes your body time to recuperate. It's just like having any other form of surgery. You need to rehab your body. And there's many men, and you, if I'm speaking with you, you may have had your prostate removed 10 years ago, and you are still dealing with the urinary incontinence. You are still dealing with the sexual dysfunction, specifically when it comes to erectile dysfunction. I want you to know you do not have to live in silence when it comes to that. You don't have to live in silence when it comes to that. You are able, there are other things, other measures that you can take that you so desire to live we're not going to say best life below the skirt, right? But to be able to live your best life below your pants. You can do it. And you, just because it's happened many years ago does not mean it stops there when the procedure was done 10 years ago, 15 years ago, 5 years ago. No, things are coming. There's new information out there. And there's other tools that you can utilize to allow you to live your best life below your pants. So I put in some information in the chat for you to have. I do offer free 15-minute consultations. Hey, let's hop on a call. Let's hop on a visual component and at a visual platform that we can be able to discuss where you are, where your situation is, so you don't have to continually to stay there. I did this series, this live for the 4 weeks, and guess what? We're running into November. What is November? November is Prostate Awareness Month. October was Breast Cancer Awareness Month. Now we're in October, Prostate Awareness Month. So I want you to know, if you have your prostate, if you ever come into a situation and you have to make the decision when it comes to having your prostate removed, what you're looking at, what some of your deficits may possibly be, or if you know you have to have your prostate removed, or you have already had your prostate removed and you're needing some assistance or some guidance, you can get it before having the procedure, and you can most definitely should get it after the procedure. So it has been great chatting with you for these last 4 weeks or so when it comes to prostatectomy, because these are conversations we're not having. These are conversations that is taboo. These are conversations that are breaking marriages. These are conversations that are not allowing us to get into the relationships that we so desire. And my biggest thing that I run into with my men are, I am not going to get into a relationship if they're not already in one. I'm not going to get in a relationship because if I can't even control my bladder, I'm not going to get in a relationship with a woman. I'm concerned about the odors that I may possibly have. If I'm having those issues, I'm not going to get into a relationship with a woman. I don't feel like I can be all the man I need to be in the bedroom for my woman because I cannot get myself to the level that I want to be. Again, as I always tell my men, there's many ways to skin a cat. There's many ways. And men, you have a bunch of tools, You have a lot of tools in your toolbox that you can use. And again, it's not, when it comes to getting your groove back, again, remember, the groove is not always the erection and the ejaculation component. It's a part of it. But getting your groove back starts with the mindset of you being there, being in the moment. And if you're not able to capitalize on what you're traditionally used to when it comes to being the Mack Truck, there's other ways you can get certain things done. But those are conversations. Again, the first bullet point I said, what conversation needs to be had? That is a beginning conversation you need to have with yourself. And that's a beginning conversation you need to have with your significant other if you do. So it's been great. I look forward to seeing you guys in the future again. I have something drumming up really, really soon because I don't want to leave my men out. Because depending on what floats your boat, right? We got Virginias, but we got Peters too. Some of us, depending what floats your boat, we can live our best life below the skirt if our man is living out his best life below the pants. So let's not leave anybody behind. Let's allow you to live your best life below the skirt, and you too, man, live your best life below the pants. So you have a good rest of the day.